Introduction to Disabilities. Goals and philosophy. We need to move from a system of offering models of service delivery to one in which supports is tailored for each person that we support. Our vision. The vision of Babcock Center is to cultivate an inclusive community free of barriers for people with lifelong disabilities. Babcock Center's mission. Our mission is to empower people with lifelong disabilities to enjoy life by promoting abilities and respecting choice. Our motto. Our motto is promoting abilities by respecting choice. Our values. Integrity, pledging to be fair, honest, and trustworthy to all concerned. Compassion, caring for people and supporting individuals. Accountability, managing resources that maximize benefits in order to provide continuity and security. Respect, valuing worth of all individuals and promoting opportunities to make choices and experience their results. Excellence, striving to understand the changing nature of the industry by listening and becoming responsive to our quest for quality. I care. Let's take a test of our vision, mission, motto, and values. Our mission is to fill in the blank, people with lifelong disabilities to enjoy life by fill in the blank and respecting fill in the blank. The vision of Babcock Center is to fill in the blank an inclusive fill in the blank free of fill in the blank again for people with lifelong disabilities. Our values. I C A R E. Fill in the blanks using the words cultivate, community, barriers, empower, integrity, accountability, support, respect, excellence, choice, abilities. The way we treat people. We need to treat people with disabilities like all people. They need to be seen as people first. They should be treated with dignity and respect. The way we treat people. Everyone is free from abuse and neglect. Babcock Center has zero tolerance for abuse and neglect. The way we treat people. We use people-first language. We believe that all people have choices that they should make. We recognize that not all people feel this way, and it is our responsibility to educate them. Some people, and in other countries, have not progressed in their understanding of people with disabilities. Self-advocacy. People with disabilities are handicapped by the environment rather than their disability. We must help people identify their strengths, then build on those strengths. They must speak for themselves and their friends. This is called self-advocacy. The quality of life is the idea that people with disabilities should have the same advantages as those who do not have a disability. People define quality of life for themselves. Quality of life includes jobs in the community, living in the community, access to the community, doing what I like to do. Support model. The support model states that progress is sequential, orderly, and predictable manner, and consequently, support sequences can be identified and used in planning programs and assessing progress. Least restrictive. Least restrictive alternatives are those interventions used by our agency that are least intrusive and least disruptive to the individual's life. Quality of life includes support by family, support by friends, support by professional staff, service coordinator, service provider, SEDDSN, support by funds to be able to live in the community, home and community waiver, Medicaid, Medicare. Deinstitutionalization. When we talk about deinstitutionalization, we are referring to the transfer of people from a large regional institution to smaller community-based settings. Labels. When we label a person who has a disability, that label hides his capabilities. Labels make us predict that people will act certain ways. If a person repeatedly hears that he or she is stupid, he or she will eventually quit trying to achieve and accept him or herself as stupid. This is called self-fulfilling prophecy. What is a disability? There are many types. Some are seen, some are invisible. Some people have several. Everyone has a disability. Developmental disabilities. What is a developmental disability? What are some of the causes? What is a developmental disability? It is a condition, not a disease, not curable, causes lifelong challenges, must be severe and chronic, manifest before the age of 18, expected to continue indefinitely and reflect the person's need for services on either a lifelong or extended basis. Causes of disabilities: genetic, prenatal, which means prior to birth, perinatal, during birth, postnatal, following birth, environmental factors. Related disabilities. The South Carolina Department of Disabilities and Special Needs, as defined in the South Carolina Code of Law, serves persons with developmental disabilities, autism, traumatic brain injury, and spinal cord injuries, and conditions related to each of these 4 disabilities. Related disabilities: mental illness, cerebral palsy, epilepsy, autism, spinal cord, traumatic brain injury or TBI, and Prader Willi. Mental illness and developmental disabilities. Some individuals that we support have mental illness. These individuals often need additional supports. Mental illness overview, sometimes temporary, impairs thinking and behavior. Some cases can be cured. Some people we support can be developmentally disabled and mentally ill. Involves life, tensions, and experience or other trauma. Mental illness, what can I do? Treat with dignity and respect, give them structure, make sure they stay on their medications, help them stay independent. Cerebral palsy. Cerebral palsy is a very diverse and complex condition with varying degrees from mild to severe. This means that each specific case of cerebral palsy is as individual as to the people themselves. Cerebral palsy is characterized by an inability to fully control motor function, particularly muscle control and coordination. Cerebral means that the cause of the difficulties lie in the brain, not in the muscles as originally thought. Palsy means having problems with movement and posture or motor control impairment. Depending on which area of the brain have been damaged, one or more of the following may occur: muscle tightness or spasticity, involuntary movements, disturbance in gait, which is walk, or mobility, difficulty in swallowing, and problems with speech. In addition, the following symptoms are sometimes associated with cerebral palsy: abnormal sensation and perception, impairment of sight, hearing, or speech, seizure and or developmental disabilities. Other problems that arise are difficulty in feeding, bladder, and bowel control, problems with breathing because of postural difficulties, skin disorders, because of pressure sores and learning disabilities. Cerebral palsy, symptoms that result from damage to the brain during early development. Symptoms include spasticity, tremors, speech, fatigue, eating difficulties. Intelligence is normal or higher. Cerebral palsy, what can I do? Treat with dignity and respect, give them time to speak and move, help with movement, help them stay independent, support when bathing and eating. Epilepsy. Epilepsy is a general term used for a group of disorders that causes disturbance in electrical signaling in the brain. Like an office building or a computer, the brain is a highly complex electrical system powered by roughly 80 pulses of energy per second. These pulses move back and forth between the nerve cells to produce thoughts, feelings, and memories. Epilepsy, a disorder of the central nervous system, and is characterized by seizures caused by head injuries, tremors, lack of oxygen, abnormal development at birth, high fevers, chemical imbalances, can be generally controlled with medication or surgery. What kind of seizures are not epilepsy? First-time seizures, drugs, febrile seizures, which is a high fever, pseudo seizures, which is stress, eclampsia, high blood pressure. Epileptic seizures. What brings on an epileptic seizure? Seizures can be sparked by a variety of stimuli, including flash of lights at a certain speed, a flicker of a television screen or TV monitor, a loud noise, repetitive sounds, alcohol consumption, cigarette smoke, stress, headache, menstruation, lack of sleep, having a bad day. Some people with epilepsy have seizures only during their sleep. Sexual activity does not trigger seizures, but seizures can also seemingly occur for no reason at all. Epilepsy. What to do? You cannot stop a seizure, so do not try. Do not shake or hold a person who is having a seizure. Do not put anything in the person's mouth, not even medicine. People do not swallow their tongues during seizures. Trying to give the medicine, however, may cause choking. Do place something soft, such as a pillow or a rolled-up coat, under the person's head. This action will help protect the head from injury. Do try to roll the person on his or her side to keep the airway clear. Do loosen ties or collared shirts. Remove any hazards such as knives or hot beverages. When the person regains consciousness, he or she may be dazed or tired. Stay calm and be reassuring. And stay with the person until he or she feels better again. If the seizure lasts more than 5 minutes, ask about a hospital evaluation. Call 911 if the person having the seizure is pregnant, injured, or diabetic. The seizure happens in water. The seizure lasts more than 5 minutes. A second seizure begins before the person regains consciousness. The person does not begin breathing normally and does not return to consciousness after the first seizure. This is the first seizure. Autism. Autism disorder, known as infantile autism or childhood autism, almost always develops before the age of 3 and is characterized by impaired verbal or nonverbal communication, social interaction, some form of repetitive and restrictive stereotype, interest, ritual, or other behavior. Autism. Difficulty relating to people. Characteristics include avoiding people, lack of attention, upset with small changes, delayed language development. Some individuals may spend hours rocking back and forth, singing to themselves, or moving their hands in front of their eyes. This is referred to as self-stimulatory behavior. Autism. What can I do? Treat with dignity and respect. Give them structure and stability. Make sure they stay on their schedule. Help them stay independent. Allow them time by themselves. Spinal cord injuries. Spinal cord injury is a damage to the spinal cord that causes loss of sensation, feeling, and motor muscular control. Spinal cord injuries. About 10,000 new spinal cord injuries, SPI, occur each year in the United States. About 250,000 people currently have this condition. Spinal cord injuries can happen to anyone at any time of life. The typical patient, however, is a male between the ages of 19 and 26. The most common causes of SPI are motor vehicle accidents, which are responsible for 50% of all cases. A fall, 20%, acts of violence, 15%, or sporting accidents, 14%. Alcohol or drug abuse is involved in many of the accidents that result in spinal cord injuries. About 6% of those who suffer injury to the lower spine die within a year, while approximately 40% of those who suffer injury to the upper spine die within a year. Spinal cord injuries. Changes a person's life. Characteristics: limited or no feeling in different parts of the body, limited body functions, limited mobility, unable to care for personal needs. Spinal cord injuries. What can I do? Treat them with dignity and respect. Give them support. Help them stay independent. Treat them like you would want to be treated. Traumatic brain injuries. Nationally, 5.3 million, 1.5 million each year, 4,000 a day. South Carolina, 1 in every 250 will experience TBI, or traumatic brain injury. Traumatic brain injury causes: firearms, 8%, non-firearms, 9%, other and unknown, 13%, falls, 26%, transportation, 44 to 50%. Traumatic brain injury. What can I do? Treat them with dignity and respect. Give them support. Help them stay independent. Treat them like you would want to be treated. Code words. I have abilities. Prader Willi. It is an eating disorder of the 15 chromosome and appears in one of 12,000 to 15,000 births, appears equally in both sexes and all races. Its important characteristics are flabbiness of muscle, insufficient development of the genital, unable to stop eating, always hungry, psychomotor delay, abnormal behaviors, morbid obesity, very obese. Prader Willi. Some signs: problems of nourishment, excessive or quick increase of weight between 1 and 6 years of age, central obesity, facial distinctive characteristics, narrow diameter of the forehead, eyes in shape of almonds, small mouth with superior thin lip and corners of the mouth drops. Man's testicles do not descend and is incomplete, and puberty gets late after 16 years of age, whereas the women do not menstruate, or they menstruate very belatedly. The delay in the global development is seen before the age of 6 years of age, and moderate in their mental delay or problems. They learn from older children. The obsession for food and to eat continually without control. Prader Willi. What can I do? Keep them active, keep them busy, help them with their weight, monitor all food, don't eat in front of them, have good supervision, treat them like you would want to be treated. Test. True or false? Number 1. There are invisible and visible disabilities. 2. People with disabilities are like you and me. 3. The support module is designed to see progress in an order. 4. Deinstitutionalization is putting people back into institutions. 5. Labels tend to predict that people will act a certain way. 6. A developmental disability is a disease. 7. Genetic, prenatal, postnatal, environmental are some of the characteristics of a developmental disability. 8. You can become disabled by touching a disabled person. 9. The main cause of traumatic brain injury is auto accidents. 10. Head injuries affect different parts of the body. 11. A developmental disability occurs before the age of 10. 12. Epilepsy is a condition in which a person may have seizures. 13. Prader Willi is a condition which affects the person so they cannot eat. 14. People with autism tend to get upset with changes. 15. Seizures generally can be controlled with medication.